I was asking for them, but I was naive as to what they were doing to me.
Pure euphoria, the way it could just take all my pain away.
Health professionals have warned we're on track for an opioid crisis as Australia faces skyrocketing rates of opioid prescriptions and related deaths.
We do have an epidemic on our hands, and it's getting worse.
New research data shows opioid-related deaths in Australia between 2010 to 2016 were fueled by some of the strongest narcotics on the market. In 2016, opioids killed more people than our national road toll.
People do not realise how dangerous these drugs can be.
In Victoria alone, we lose a plane load of people every year through this overdose of prescription medication.
The consequences are grim.
The 28-year-old was discovered by his housekeeper. Prescription drugs, including sleeping pills, were nearby, leading the police to believe he may have died of an overdose.
Of the 8,421 fatalities over 2010 to 2016, 1,881 involved oxycodone, an addictive painkiller aka OxyContin. A further 757 involved fentanyl, a synthetic opioid up to 100 times more powerful than morphine. Dispensing rates of opioids have also increased 15-fold since the 1990s, and people addicted through these prescriptions are hitting the dark web for their fix.
And as you swing the camera around behind you, that's the other part we got to fix.
John was my big brother. He was on Valium, he was on Endone, which is in the oxycodone family. He took his medication as prescribed and he died.
The rise of opioids in Australia has seen deaths double in a decade. Australia now has the 8th highest per capita opioid consumption in the world. And as opioid abuse was rising in Australia, pharmaceutical companies like Mundipharma, an affiliate of US-based OxyContin maker Purdue Pharma, were going to great lengths to promote their products. Mundipharma spent millions of dollars to fund and sponsor thousands of medical conferences, dinners, and training seminars, according to transparency reports filed between 2011 and 2015. Governments and regulators have reacted slowly to the crisis despite years of warnings from coroners, families, and the medical profession.
The problem that we have with these drugs at the moment is that we're using more and more of them. 30 or 40 years ago, they used to be used primarily for cancer pain, and it turns out that that was the right thing.
3 years after pledging $16 million to roll out national prescription monitoring, the government still cannot say when the project to combat opioid misuse will be delivered.